Check. Okay. So, welcome to the second of the 3 series on ICUDDR updates. For today, we are going to talk about building a competent addiction workforce, the significance of international certified addiction professionals, ICAP certification. We are very happy to have you with us today. So, some housekeeping announcements. Translations for closed captions in various languages are available. To turn on this feature, click the CC icon at the bottom of your screen and select the closed caption languages of your choice. If the CC icon is not showing up, you have to press the More button and then it's gonna be there. So for your questions, feel free to type in the chat box anytime during the presentation, and our Steam speaker will respond to it at the end of her presentation. And lastly, we wish to inform you that this webinar is being recorded. So I think it's about time that we start. Everyone is almost here. So it is my pleasure to introduce our speaker for today, Dr. Carmel Clancy. She holds the esteemed position of Dean Emeritus at the Faculty of Health, Social Care and Education, Middlesex University, United Kingdom. She is currently a registered with the Nursing Midwifery Council as a mental health and an adult nurse and has over 30 years experience in delivering nursing education at both undergraduate and postgraduate level, including addiction curriculum development. She was the course developer of the first master's comorbidity in Europe. So between 2020 to 2023, Carmel held the office of the president of the International Nurses Society on Addiction. So Dr. Clancy was also appointed as the chair of the Research Advisory Panel in 2022 for a new university's UK task force on student drug use. The task force was set up to help universities understand and address drug use and is due to publish evidence-led sector guidance, including recommendations that are based on harm reduction this year. Dr. Clancy has written extensively in this area and in 2017 co-chaired a Public Health England working group on the nurses' role in the treatment and recovery addiction pathways. Dr. Clancy has also served as a member of the Advisory Council for the Misuse of Drug, a standing committee which advises the UK government on drug issues and policies. In 2015, she was awarded a fellowship by distinction and entered onto the membership register for the UK Faculty of Public Health in recognition of her contribution to the addiction practice. She has provided training to addiction professionals throughout the world and is currently the Associate Director for, sorry, GCCC.
My introduction is killing you, Verna. Maybe we should stop.
No, but because you deserve it. Ladies and gentlemen, without further ado, our very own Dr. Carmel Clancy. Carmel?
Oh, Verna, that's very kind. And I'm really genuinely delighted to be able to come and present at this webinar series. And so thank you very much to my ICUDDR colleagues, and particularly the Centre for Educational Development, Verna and Carly and Caleb, who run this particular webinar series to give me an opportunity in my new role as the director for the GCCC, which is the Global Centre for Credentialing and Certification, which now sits and is housed within the ICUDDR family. And I'll maybe do a little bit short introduction to that because there's been a lot of change around GCCC. Many of you may be actually attending the webinar series just to get updated. So hopefully I will be able to do that alongside obviously introducing myself as the new director and hoping to get to know our constituents, our audience, people who are very keen and interested in workforce development, capacity building within the addiction sector, and particularly credentialing. So just to, and I should say, I'm not sure if Verna did amongst all that very long introduction, I must shorten my bio actually. the most significant piece for me is that I'm actually ICAP credentialed myself. I'm ICAP level 3. So I've been there, as they say. I've got the T-shirt, and hopefully I understand a little bit about what it is to go through the process. And now it's particularly personally interesting for me now, having done that a few years back, to be sitting on this side of the fence. So I'm very keen to take my own experience, but also the experience of many of you who are credentialed, maybe thinking of re-credentialing, or those of you who are very interested in credentialing, engaging with you in a discussion. So for today, what I'm hoping to do is to take us through sort of four areas, and leaving, I hope, significant enough time for us to open up to the floor in relation to questions and answers. I will say to you that because I'm relatively new as the director, and we are going through a period of auditing and reviewing our practices, and I'll explain why in a moment, there may be some questions that you raise which I'm not necessarily going to be able to answer. They may be very personal in terms of your own circumstance, your own country, your own particular profile. If that is the case, I don't want to stop you from asking. So please do use the chat, or you can, and you will see at the end of this, my link to my email and to that of my to my team. And I'm very pleased to say that Sunju Park, who's one of our program officers, is also on the call, and so he will be available also in the background. So hopefully, maybe Sunju, at the end of this, you can say hi as well, so people can get to know you. So this is really what we're hoping to do. And I'm going to try and do it, as I say, 45 minutes, and then we'll use the remaining time for an open Q&A. So a short overview, really an introduction or reintroduction to GCCC, because of its recent transition to ICUDDR from Colombo Plan DAP. Many of you will know that historically GCCC has been looked after and developed and indeed managed by DAP. It's now with ICUDDR, and I'll explain a little bit about that shortly. We're going to hopefully examine key factors driving the need for a skilled workforce in the addiction services and the current credentialing landscape. So for those of you who are with us this morning, this afternoon, this evening, depending on where you are in the country, you may be interested in that information in relation to your own country, so you can benchmark perhaps where you think your country is, or your services, or indeed you are personally. So we can start to understand some of the challenges that we're facing generally as a sector globally. Looking at recognizing the benefits for career development and understand the value of the ICAP certification. As they say, credentialing or certification, ICAP is just one. There are others, as they say. I mean, obviously, I'm going to be presenting the information about how you can have an ICAP certification, but there may be others joining us today who are credentialed within their country, and we can explore how there might be some reciprocity or a realignment with the ICAP if that's of interest to you. So I hope to touch on that as well, and then explore in detail more the credentialing and the re-credentialing process. So if you have been thinking about credentialing and are interested to know how do you go about that, I'm going to take you through step by step. So forgive me if there are those of you who have already had that experience, but also if you're coming, you may actually now be thinking, I need to re-credential, because we ask anybody who's on our register, they should be re-credentialing every 3 years. And you may be wondering, how do I go about doing that? And I'll be taking you through those steps as well. So that's what I'm hoping to achieve and cover. So as I'm presenting, I'm just going to go through the presentation. I'm not going to necessarily stop, but as and when you hear the presentation, if it prompts you on any questions, please just put them into the chat. My colleagues are very kindly looking after that for me, and then presumably will cluster maybe the queries together so we can pick those up when I stop talking. So please just sit back, hopefully in a relaxed way, and I'll take you through what I'm hoping to cover. So starting off, really, if you are, know about GCCC and know some of its history, this will not be a surprise. But for those of you who are interested to know who we are, it's really just to give you a sort of a quick overview and roadmap of GCCC. So GCCC, as you can see, started out in 2009. It was established under the Columba Plan's Drug Advisory Programme with the aim of providing training and credentialing for addiction professionals. And I have to say, very, very gladly, it was funded by the US Department of State's Bureau of International Narcotics and Law Enforcement. And indeed, INL continued to support this programme and these activities to today. It was called ACE initially, Asian Centre for Certification and Education, and there may even be some of you who are still around from those days and recognise that tag. Then in 2015, and really as a result of the efforts by Columba Plan DAP team, they continue to work obviously tirelessly and expand and grow, and they indeed grew the commission, and I'll come to the commission later in the presentation, which supports the efforts of GCCC, to 24 members. And it started to take on a much more international feel as opposed to just being regional via an Asian feel. And so the group decided to rebrand and change its name. And so by 2013, ACE reached 1,500 professionals. And then by 2015, it had expanded to 24 members within its commission. So it changed its name to ICE, International Centre for Credentialing and Education of Addiction Professionals. And then that growth continued, as you can see, and ICE eventually in 2019, shortly after, really 4 years later, evolved into a new name, which it currently holds, which is the Global Centre for Credentialing and Certification. And so from 2019 till literally this year, 2024, and throughout its growth and development, it has been managed and looked after, as I say, by Columba Plan DAP team and funded through the INL. And then earlier this year in 2024, the decision was taken to transfer the credentialing aspect of the work that Columba Plan was undertaking through GCCC, and transferred it over to the ICUDDR. And so again, many of you who are attending these webinars, I'm sure, are very familiar with ICUDDR, but if you're not, it stands for the International Consortium of Universities in Drug Demand Reduction. So we believe that decision to shift the credentialing into ICUDDR network really repositions and leverages the consortium's global network and resources, and we hope will accelerate efforts to enhance the professional standards and ensure more widespread adoption of credentialing. And I'll explain how we're hoping to do that through the efforts now under ICUDDR. So that's sort of a quick roadmap. If you're not familiar, as I say, with who ICUDDR, even though universities is in the title, I think that it's important to recognize that it's not just universities who are our members, but we believe we are a global now consortium of institutes of higher education. And we see really our byline or our tag as linking science, policy, service, and education to address substance use challenges and strengthen communities. So if you're ever wondering exactly what is or who is ICUDDR, that's sort of our little tagline that we are now using, which hopefully explains to you sort of the core of our business. In terms of our goals, you will see credentialing right there in the middle. So, and I'll explain where that fits overall within ICUDDR structures. But as you can see, and no surprises, given what I've just described as the mission, so to speak, or our purpose, we're involved in education, research, the credentialing, which our centre is driving, advocacy and dissemination. And to be quite honest, even though we are focused as a centre on credentialing, I would argue that we are actually leveraging all of those aspects in various forms, and vice versa with the directors from the other centres who I will talk to about in a moment, and how we sort of now in effect interlink and leverage each other's work. But ultimately, without going into the detail, hopefully it's given you a moment to see exactly what we're about. So in education, it's about the availability of addiction studies by increasing the number of colleges and universities offering specialised degrees and programmes. And what I will hopefully doing with the team is looking, and this is where we're leveraging our involvement now with ICUDDR, is how might we work with those universities or tertiary educational providers in embedding the credential. So if any of you are sitting from a position where you're currently engaged in curriculum development, or you are indeed leading or in working with people who are taking degrees within your respective institutions, and you would like to tag in a credential alongside your assessment processes, we would be very happy to open a conversation with you. The other aspect of the work that we're very keen to do is the research aspect, and we have our own research centre in ICUDDR. And of course, credentialing is only one aspect. I'm sure you all understand. It's almost in some respect an end product, but there is a lot of things that need to go on before we get there, and indeed also continue to grow. And I know that the centre, in terms of GCCC, is wanting to expand now its understanding about workforce development within the sector. Who exactly is the workforce? What are exactly the workforce needs? And indeed, what are the policies and toolkits that are really required at an in-country level to drive up the standards around education, professionalization, preparation, not only for those who are working in the field, but hopefully the next generation. And that's again where our universities who are preparing the next workforce coming in through health, social care, the digital system, etc., will be able to have that conversation, we hope, with us about how we can start to think about pre-service education as well as postgraduate training and continuous professional development. Credentialing is of itself what it is in terms of our goals, and ultimately, you know, I would say my passion along with my team in ICUDDR, and I'm sure with many of you listening, is that everybody gets credentialed in this field, and I'm sure I'm speaking to the converted with regards to that ambition. The last two really are advocacy and dissemination. Although there have been amazing strides, I would argue, both in country and globally, and many excellent stakeholders doing some really high level work, we still really need to continue to advocate. We know that stigma, unfortunately, still remains a very difficult challenge for all of us to work with, very difficult for us to put forward our arguments as to why we need this type of approach, and particularly a systemized approach to developing a workforce that is able and capable, against a backdrop often of stigma where people really are perhaps not kind in their thinking about people who unfortunately end up with the substance use disorder, and indeed their families and communities suffer. So there's still a huge amount of, I believe, advocacy and certainly dissemination as to why we are doing what we are doing. So really what ICUDDR is really ultimately around is about trying to support the professionalization of the workforce, and you can see some of the steps that we're trying to do that, and the credentialing is one of those. And if you were unfamiliar with the membership, you saw the call out and call to action by Verna earlier at the beginning. She was saying, if you are a faculty member, you're very welcome to join us, and there will be a link at the end of this webinar if you want to check us out and see what's available and the benefits, both as a faculty member individually, but also we're very keen, and as you can see, growing rapidly in relation to our university or higher education members. We already have 456, and I'm pleased to tell you that the director of our Educational Development Centre is also on the webinar in the background, Carly, and I'm sure she would be very happy to address any specific questions. But at this point, our global footprint is reaching approximately 95 countries. So you can start to see, and I think the value, as I'm sure most of you will appreciate, is that through a network community, our voice becomes incredibly powerful in this space. And that's where I think it's quite exciting also from the credentialing point of view. If your country is yet to still understand the value of that, or recognize that, or indeed embed it as part of its quality indicators, then being part of a network where we are advocating for this approach and other countries are already leading the field, you will have that voice added to your argument locally. So it's something to think about when you're thinking about joining us in terms of membership. So we have the 4 centres, and there is a real codependency developing in relation to or a symbiotic relationship between our centres. I think it goes without saying, which is what I was mentioning at the top end, one of the reasons why bringing GCC into the ICUDDR network has been, I think, a really inspired move, because we now are aligning with 3 other centres all similar missions, but with a slightly different angle and lens and focus. But I hope you can see from the type of activities each centre is actually focused on, how our credentialing centre will interface with those centres, and we can look strategically together as to how we can leverage the workforce development. So of course, if you're going to take on credentialing and want that to be, in effect, having a very large footprint and reach, aligning with the centre that's looking at systems change is going to be extremely important, alongside then, as I say, the research around workforce preparation, workforce planning, needs assessment with regards to the workforce and who they are, and then obviously having that wider university, higher institution, educational institutions supporting us as well. So those are the 4 centres. So let's talk a little bit then specifically about GCCC. If you've not met us before, this is what we're doing specifically. So we believe our mission is to ensure the highest global standards in the prevention, treatment, and recovery of substance use disorders through rigorous experience and practice verification and comprehensive certification exams. GCCC empowers governments, we believe, healthcare providers and employers to select only the most qualified professionals. So this commitment, we also argue, will drive obviously excellence and improve outcomes for our individuals who are affected by substance use, their families and communities, and we hope fosters healthier societies and more resilient systems of care. So currently we have within our register 2,241 professionals who've been credentialed, which is a substantial number in of itself, but it is still far too small as far as we're concerned. So we're really keen to grow that number exponentially, and that will be one of our main drivers this coming year. But the footprint is also quite favourable in that we are, at least at this point, recognised in 80 countries. So this is the team. So you can see me, as the new director. Then Sunju, who's sitting in the background, who hopefully will get to say hello to you again. He is a program officer with us. We have Samita and Ashley, who are more of our longer standing members, and many of you who are familiar with GCCC will know that Samita and Ashley also worked with Columba Plan, and they transferred over to ICUDDR. So they really have a lot of muscle memory for me, or institutional memory, and I'm very, very grateful for their support as we take forward the next couple of years, driving through and up the numbers in our credentialing centre. So those, if you're not familiar, at least you get to see the faces and you can see who you're communicating with via email. So a little bit really about how we are managed. Previously, we had a governance structure with a Columba Plan DAP, where there was a formed commission, and the commission really was set up to oversee the governance, in effect, of the delivery. Now that we've moved over to ICUDDR, obviously we're governed through the ICUDDR, which has its own board. So we are currently at this moment reviewing our commission. We had a fabulous meeting, I can report, yesterday, where commissioners from around the different regions came together, and we're starting to look at really what is that commission's role, what is its purpose, and what will be our work streams as we go forward over the next 12 months and further. So watch this space, and if you get the newsletter, which I'm sure you are tapped into from the ICUDDR, the newsletter gives updates on a regular basis. So keep an eye on the newsletter to see what we're doing on a day-to-day sort of operational level as we move through. But ultimately, our purpose, as you can see, is to develop the standards of requisite knowledge, skills, and experience mapped to competency frameworks in substance use disorder in the area of prevention, treatment, and recovery support. We provide evaluation mechanisms for measuring and monitoring that level of knowledge, skills, and experience required for the ICAP credentialing and our certification programs. We establish policies and guidelines for acquiring and maintaining those credentials and certifications, obviously in accordance with non-discriminatory practices and other pertinent guidelines. So in effect, what we're we're showing and demonstrating is that we are setting a standard, and then we are holding ourselves and our credentialed professionals to that standard. And ultimately, we ensure that the credential remains fit for purpose and are proactively future-proofed to meet the evolving needs. Many of you know that we cannot stand still. Anything that we may have done or trained in 10, 15 years ago, although some of the core competencies will still be relevant, but there are emerging competencies now required, and not least would be if we even just take AI, artificial intelligence, digital skills, and how that is now starting to map through in terms of treatment programs, online, etc., etc. So we need to continuously be looking at what are the competencies required in the field, and how do we ensure that we have, in effect, got a sustainable approach to making sure that we are, as I say, fit for purpose. So key factors really driving the need for a skilled workforce. And I just want to touch on this, although it may seem very obvious to some of you in the audience, it may not be for others, and perhaps others have come today wondering why would this be useful in your country to consider embedding a credentialing set of credentials, I should say, or system in the addictions field. So these would be some of the arguments that we would suggest that are available, and more than happy to have a discussion with you individually to start looking at. So key factors driving, in effect, the need for a skilled workforce, as you can see, is the rising rates of substance use disorders. Unfortunately, despite all the efforts, and certainly we all know we've done and we are doing extremely well, we know that we actually are moving towards a much more evidence-based approach, and data science is starting to support us. The problem is still not receding. It still, unfortunately, represents, and it represents differently in different regions. And so it's a constant moving and shifting picture. But certainly we can feel confident that we're on top of it. So those rising rates and that footprint really of destruction that often is associated with people who are engaged in substance use disorder or impacted by it, by the community or indeed families, we recognize that we need to have a workforce that is able to lean into that. And examples I would suggest as well is the changing nature of the populations that we're coming across. Unfortunately, we're starting to see increases in younger people starting to take drugs. So in effect, the need to have more specialized workers who understand the complexities of working with people, particularly young people, children moving into teenage years, is a very different type of profile of patient or client than somebody who's in their early 20s or early 30s. Equally, we know that we have had substantial increases in the number of people, older people, people 65 and above, who have either had a history of substance use earlier in their life and have now moved towards older age, or indeed due to multiple bereavement. And by that, I mean bereavement and loss of role, identity, retirement. We're starting to see increase of that particular age group, moving towards, sort of a response framework for themselves in terms of use of alcohol and other drugs. And so we're starting to see an increase in that age group. And again, this is a group that is often sort of not considered, naturally to thinking, oh, older people are using, substances. So again, we constantly have to think about different specialist populations. We need to think about the types of drugs that people are using and so forth. So that requires us to continue to provide a workforce that understands that and knows how to lean into it. The other, of course, is complexity of addiction. We know that codependency or co-occurring disorders is huge. Increasingly, we know that the neurobiology of addiction, we know addiction alters brain function, making treatment approaches more complex and multifaceted. Effective addiction treatment now requires knowledge of how substances affect brain structures involving reward, decision-making, impulse control. So if you're coming from a background where you've not been exposed to training or understanding and believe still very much in the moral theory that really this is just a behavioral issue and people just being bad, so to speak, and the stigma that's associated with that, then you can understand why we have to come together to make sure and get people to appreciate the complexity of addiction as a chronic disease, notwithstanding, of course, co-occurring disorders. And many people, as we know, experience mental health disorders, including PTSD. Trauma-informed treatment is very much on the rise and very popular in terms of recognizing the evidence now associated with care, associated with that area. We know that there is evidence in terms of treatment models, and we know that examples are widely, unfortunately, there are still examples with widely used non-evidence-based practices, such as detoxification with no follow-up, religious education in isolation, cold showers, physical restraints, beating, starvation, hard labor, and media campaigns in terms of the prevention area with no follow-up. So still lots and lots of work to put that evidence out there. It exists, but it needs to be disseminated. Shortage of skilled addiction professionals. We certainly know that we have increasingly a shortage of that. We're not preparing our pre-service education colleagues who are maybe studying nursing or medicine or psychology, social work, for example, in universities. Often they're not exposed to this training because there aren't the faculty members to teach them. Indeed, faculty members may argue that the curriculum is already crowded. How can we put in addiction into that? So there are many reasons and many areas where we falter before we actually can have this skilled addiction professional. So again, another factor driving why we need particularly credentialing, and we need to come together to make those arguments. We know that there is increased public and policy support for addiction services, and indeed we know regulatory and certification requirements are on the rise. So the demand for this is increasing by many countries who are looking to develop their standards and quality measures. Many jurisdictions now require addiction counsellors and therapists to hold certifications, which necessitates specialised education and ongoing professional development. And indeed, I've just returned from Kenya, which has begun implementing credentialing as part of its regulatory oversight in rehabilitation services. When they do their inspection, they are seeking to look that each service has at least 2 members on their team who are ICAP credentialed. That starts to give you an idea of how certain countries are starting to use credentialing as an indicator of quality, which is incredibly important. We have, as you know, increasing peer support and recovery coaching, and many people who come in through that route are people who are ex-users themselves and who need support and need guidance, and the fact of having a credential validates indeed their experience, but also allows them to train and to present and verify so that as they join the treatment provider skilled workforce, they have evidence to suggest that they are meeting those standards. And then finally, as you know, we have the technical advances in treatment, which I mentioned. So with the rise of telemedicine and digital health, addiction services are increasingly being delivered through remote platforms. This trend has created, I believe, a new demand for addiction professionals who are comfortable using technology to engage clients and deliver therapy. So we do need telehealth competencies. They'll need to be trained in terms of how to use such telehealth platforms to deliver care, ensuring patient privacy, engagement, and adherence to treatment and protocols. And then digital therapeutics and apps. Many of you, I suspect, have been involved in looking at new technologies, including smartphone applications for tracking recovery. Digital cognitive behavioral therapy is delivered now via apps, and virtual recovery communities have been integrated into treatment, requiring addiction professionals to be knowledgeable about these tools. So really, if you oversee, there's many, many factors that are now influencing our need to ensure that the addiction workforce is fit for purpose and prepared. So just a little history as well, if you're not aware, key milestones in credentialing in the addiction services. It's not new, although I would suggest in the latter 10 to 15 years, there's certainly been a greater emphasis. But if you take a historical perspective on this, you will see that credentialing has been around very much since the 70s. Initial efforts started to professionalize addiction counseling and establish standards for training. This was particularly, I should suggest, is particularly within the USA, and people will be maybe familiar with the formation of NADAC and ICRC. which is the International Certification and Reciprocity Consortium. And they did the first development of the first formal certifications like the CADC, which is the Certified Alcohol and Drug Counselor. And then during the 90s and continuing into the 2000s, there was expanded certification programs, recognitions of credentials by insurance companies, and establishment of state and regional credentialing bodies. And as you see, specialization of credentials for specific treatment areas continued into the 2000s. And really, since 2010 to present, you're starting to see the adaptation to digital platforms, continued development, and a growing focus, particularly, which is very welcomed, on peer recovery support. But it does vary by region, and it does vary by professional background, and I'm sure that that is your own experience. Each credential typically, though, has specific educational requirements and backgrounds. There also needs to be evidence of experiential learning and practice, and then examinations are required. As I said, the United States was one of the most developed and extensive histories of credentialing in the health field and stands out for its extensive and multifaceted approach to credentialing. But the majority of credentials still, even within the states, are recognized at the level of the country or particularly the state. So even if you, for instance, have an ADAC credential or the ICRC, that has to be done at state level. It doesn't necessarily just automatically transfer over. And I'm happy to speak to that if there are particularly questions about reciprocity towards the end of this presentation. But just to also give you a flavor, and many of you may recognize on the left-hand side, hopefully it's the left to you that you're seeing, but you can see the sort of the type of credentials that are out there and the titles of the credentials. So you can see general addiction counseling credentials, specialized credentials, particularly in clinical supervision, co-occurring disorders. Then you have medical and allied. So you've got the International Certification in Addiction Medicine by ISAM, which is the International Society for Addiction Medicine. You've got the CARN, which is the Certified Addiction Registered Nurse, and the CARN AP. That is available to nurses who are working particularly in North America. Certified Clinical Alcohol, Tobacco, and Other Drugs Social Worker certificate, and then a board certification in addiction psychology. There's peer support credentials, and then there are educational and training credentials. So if you Google any of those, you will be able to find them. The ones that I will, of course, be talking about are the ones on the right-hand side, which is offered through ICUDDR GCCC, which is the ICAP portfolio. And as you can see, we have largely three areas that we cover. Treatment, which is from level 1 to 4. We have prevention, and then we have recovery. And I'm going to go into a lot more specifics on the presentation regarding that. But just the value, I think it's important to talk about why we think there is a value associated and tagged with the ICAP certification. So I would suggest that the first is it ensures competency and professional standards. So credentialing establishes a baseline of knowledge and skills required for professionals working in addiction treatment. It helps ensure that practitioners are equipped to provide effective care based on the latest research and best practices. It fosters a standard of competency. I believe that protects clients and enhances the overall quality of treatment. And I'm sure, hopefully, nobody's going to necessarily argue at that. But equally, it enhances client trust and safety. Unfortunately, when we talk a lot in terms of actually our credentialing, we demand that our credentialed practitioners all adhere to a particular ethical framework and sign up to an ethics statement for all of the right reasons, but particularly because we know that our client group, our patient group, are a often marginalized and particularly vulnerable population. And so, you know, many clients do require a very obvious verification and validation that they are seeing somebody that they can actually trust and feel safe with, because that may not have been their previous experience. So clients seeking help for addiction often face stigma and vulnerability. We know that, but knowing that their treatment provider is credentialed can instill a sense of trust and safety. Credentialing signals, I believe, that the professional has met specific educational and experiential criteria, which can encourage them to engage more fully in the treatment process. As we know, it does, there are many factors that often act and hinder and get in the way of our clients either approaching or engaging or being retained. And certainly trust and feeling safe is paramount to that. So I think by offering a treatment service where a credential is available or credentialed staff are available, it starts to address that certainly. Facilitates interdisciplinary collaboration. Addiction treatment often involves multidisciplinary approaches, requires collaboration. We all know that not one of us can do this on our own. And in actual fact, if we want our clients or patients to benefit, the fact that we have an interdisciplinary and multi-agency approach really sets a standard and offers a huge amount of help. So it requires that collaboration amongst the various healthcare providers. Credentialing, I believe, standardizes qualifications across disciplines, making it easier for professionals to know and understand their role. As they say, make sure you stay in your lane. Often we falter a little bit, so it's really helpful to know when somebody is credentialed, what is it that they're credentialed? What is that benchmark? What is the expectation of their role, and what is the competency that they're bringing to that role? So by having a credential that is understood and is recognized globally and shared, standardizes that for us and makes things, I think, easier for us to work together. It also, of course, as I say, underpins the ethical practice. So credentialing includes a commitment to ethical standards and professional conduct. This is particularly, again, important within the field where we have our vulnerable populations who are and have been easily exploited. By adhering to these guidelines, credentialed professionals help protect the client's rights and promote ethical practices in our field, which we know is sadly needed in some areas. What it also does, I think, on the professional side, is it promotes accountability and indeed professional growth. So the credentialing processes often include ongoing education and training. You can't, just sit on your laurels, as they say. So, I have my credential, that's it, tick, I'm done. No, not at all. We, particularly in the ICAP and any good, I would say, credentialing facility and service, requires you to continue your learning, to be engaged in lifelong learning. As I've just been explaining, as we learn more in the field, as evidence becomes more available to us, as the science presents and teaches us, then we need to keep up with that. And we cannot assume that what we were taught 5-10 years ago is the same practice that now sits comfortably. So therefore, that promoting that accountability to keep oneself updated and allow for that professional growth ensures that our providers continuously improve their skills and their knowledge. The other area which I would suggest for those of you who have obviously to keep an eye on the bottom line, for your services, is that it does increase access to funding resources. Certainly, if many insurance providers and funding agencies require credentialed professionals to qualify for reimbursement or grants, by ensuring that your practitioners working in your particular services are credentialed can enhance access to essential funding and resources, and therefore, of course, allowing more individuals to receive the care they need. So I think that, one can't ignore the fact that as a quality marker, as a kite mark, any funder will be seeking to ensure that the services that are being provided by the right set of professionals. And ultimately, we're all very involved in understanding of sustainable development goals. Governments have their strategies, everybody is trying to align, they're very ambitious, the agenda and the goals for 2013. Sadly, there's a struggle there. Many are already recognizing that they're falling behind, but that if you really want to look at where we may contribute to public health outcomes, addiction ticks, as you know, in the 3.5 of the SDG area. We tick huge amount of boxes in relation to SDGs. So it contributes certainly to healthcare or public health outcomes. So effective addiction treatment is critical, and effective treatment really is only brought about by quality standards and a professional and competent workforce. So again, credentialing ensures that the treatment providers can deliver evidence-based interventions, leading to better recovery rates and reduced rates of relapse. This ultimately benefits, obviously, our individual patients and communities, But equally, if you're at a country level and you're a government agency at the moment hearing this, I would hope that you would join those dotted line, those dots together, and recognize that by investing in a credentialed workforce, you are ultimately investing in public health outcomes and meeting your SDG goals. So the value, credentialing addiction field is not merely a bureaucratic hurdle. It is a vital component that enhances the quality, safety, and effectiveness of addiction prevention, treatment, and recovery. And we believe by establishing standards and promoting professionalism, credentialing ultimately leads to better outcomes for individuals seeking recovery and strengthening our overall healthcare system. So it's not only a credential, it's beneficial. We believe it's transformative. It's for the professional. We believe it's a gateway to career growth and global recognition. For the employer, we believe it's a guarantee of quality and efficiency. And for the government, we believe it's a powerful tool in combating addiction, improving public health, and aligning with international development goals. So hopefully I've made a reasonable argument if you had been in any way doubtful as to why would I think about being credentialed, or indeed why would my treatment service want to be credentialed and have credentialed professionals, and indeed if I'm a government representative, why would I want to engage in this area? I hope that the arguments put forward have given you some food for thought, and certainly happy to open the conversation further. But the workforce that we are talking about, and this is just a sample because I know that there are other types of professionals working in certain countries that are not necessarily recognized in outside globally, but just to give you a flavor, this is a group and it's very far reaching. The people who are working. We know that addiction, holds no boundaries, is completely indiscriminate in terms of who and what it attaches itself to. So you will find substance use disorder from, school level children right through, as I said, to older people, right through your community. And it's not about just finding it within the prison or judicial system. It's not about just finding it in emergency departments. It's not just about finding it in mental health institutions. You will find and see this everywhere. So I would suggest that the entire workforce needs to be brought up to at least a minimum level of understanding of addiction. But then I suspect you would expect me to say that. So our credentials, as I say, fall into three. So I'm just going to move now into the credentialing process and what it means and what we're doing within GCCC. So we have three areas that we cover: prevention, treatment, and recovery and support. This is quite tiny, but don't worry because I'm going to take you through this in a lot more detail. But what you can see here is the particular qualification. We talk about the minimum requirements, then we talk about the training hours required. We talk about supervised, as in how many years of work experience you require before you can put yourself forward, and then the costs. All of these are currently being reviewed, particularly the costs. I'm sure that may be something some of you would wish to raise, but we are trying to address that. As you know, we are an NGO, i.e. non-profit. Our intent is to bring this to everybody, and what we're trying to cover is really just the cost associated with the delivery of this, as opposed to making any profit. So please appreciate that really is what's driving us. The treatment exams are available in 16 languages. Hopefully that's of particular interest. It's important that we make sure that when you're taking this exam, you are not in any way reduced, or your ability is reduced just because you're not taking it in your native tongue. And exams are available both in person or remote. And I'll talk about the registered nurse ICAP in a little while, because that is pending and coming. And some of you who may come from a nursing background, or indeed running nursing colleges of training, may be interested in that one. So this is just giving you some further details. It's a busy slide, and these slides will be available to you. And indeed, they are available on our website if you want to study them further. But as you can see, if I start with the treatment, so this is the ICAP level 1 treatment, ICAP level 2, 3, and 4. As you can imagine, as you work your way up the levels, the greater experience is required, the greater amount of qualifications in terms of higher end qualifications, from starting to go to masters to doctorates as you move towards the higher levels. And then you have to have done some successful completion prior in terms of ICAP 1 perhaps, or if you come from no qualifications, and by no qualifications I don't mean to underestimate, you know, sort of what people have done in terms of life experience, but I'm talking about that formal education through university and so forth, then we are looking for at level 2 and level 1 high school, secondary diploma or equivalents. So it is open to everyone, and I would suggest that if you're unsure about your profile and you're struggling to understand the information, please reach out to us. We have, as I've shown you the picture, we have staff available. Hopefully we're responsive. We're trying to get better, but please do reach out, and we'd be happy to have individual conversations with anyone who is struggling with the criteria. But as you can see, it talks about how many contact hours, and again, contact hours increase depending on the level, from 120 contact hours of education and or training in substance use related subjects, including at least 6 contact hours of HIV/AIDS and 6 contact hours of ethics, up to 500 contact hours of education if you're attempting to take the level 4. So it increases as you go along and depending on your expertise. For prevention, we have 1 level at the moment. So I know that there may be many prevention workers listening. So in relation to prevention, we have an ICAP Prevention 1. People need to show that they have 2 years full-time or 3,000 hours of working experience in prevention of substance use, and a bachelor's degree in a relevant field, which is the health and social care largely, or teaching education or behavioral sciences. Or if you don't have that, 4 years full-time or 6,000 hours working experience in prevention use with a high school diploma. So written verification of competence is required in the prevention skills and functions by a certified supervisor who's personally observed the candidate who's been engaged in prevention, or a work contract indicating prevention activities as part of the deliverables within your role. An application narrative must include specific prevention activities. You require a minimum of 120 documented hours of prevention education and training. And again, similar to the other ICAPs, we're looking for ethics, but we're also looking particularly for 6 contact hours of physiology and pharmacology, and submission of a signed and dated statement that the candidate has read and agreed to the code of ethics. You will see that that is similar for all of our ICAP credentials. We also have an ICAP recovery support credential. This requires 1 year full-time, at least 1,500 hours of supervised working experience in the recovery support related field, and passage of the first public examination, high school, secondary diploma or equivalents. Again, written verification of at least 1 year of supervised experience, as you can see, an application narrative, 100 contact hours of education or training, and again, 6 contact hours HIV and 6 contact hours of ethics training. And then you see there's a pending ICAP RN. So the ICAP RN is for the registered nurse level 1. So this is available and open to any nurse who is registered in their country as a registered nurse. This is going to be coming online, we believe, around March or April. And there has been a new course developed called the Universal Nursing Addictions Curriculum, similar to the UTC, UPC, but this is specific for nurses. It was piloted in Greece in June. It's going to be going to UNODC for review in the next coming months, and we hope that that is going to be available on the ICAP platform. So again, please watch that space. So if you're thinking, how do I start this process? So let me start with people who do not yet have a credential. What do you need to do? So what we recommend is that you join ICAP, and I'll come to that. I'm going to break this down so you can just get a flow. You join ICAP, which is the International Society for Substance Use Professionals, which is a global network. If you haven't already joined, please consider it. I'm going to show you where you can do that shortly. It's free to join, and it is a wonderful community of professionals working across the globe where there are an abundance of resources, including the Knowledge Hub, where you can actually take self-directed courses which are really set up with the intention of preparing you to take the ICAP credential. It's not the only training that you have to take, or indeed that you must take, but it certainly gets you further down the line in preparation for the ICAP credential than perhaps you would do just on your own. We recommend then that you either take courses through that platform or others, and we're happy to talk to you about that. Or if you have already been taking courses either as part of a university course, we're very happy to map that with you and look to see whether that would bring you to a point where we feel that you would be set up to take the ICAP credential. And if you are somebody who is delivering those courses within universities, as I said at the beginning, very happy to have that conversation with you as to how you might embed the credential as part of your assessment process also. We need you to document your experience. You then would submit an application. You go on to take an exam. If you're successful, you get issued with a credential and you're placed on our live register, and I'll come to that in a moment. But you equally at some point may wish to come back in to the process by increasing and uplifting your credential, particularly in the treatment route where we have the ICAP from 1 to 4. So you would enter again, and you again would submit, take exam, and then go on to the live register as an ICAP 2, 3, or 4. However, irrespective of which credential you take, you must re-credential. It is only live for 3 years, and we have a whole re-credentialing process, which I will take you through also. So here's just broken down, as I mentioned, starting with joining the ICAP Global Network. If you take a screenshot or if you just make note, that is the link. It will take you directly to the ICAP platform. You can register for your membership and then obviously engage with that particular platform and the resources available. You can then take courses, and there are, as I say, an entire suite of professional development. There's the UPC, Universal Prevention Training, the UTC, the Universal Treatment Curriculum, etc. There are various other courses, and you can either take them as self-directed, or if you are a trainer or a trainer provider, you can actually negotiate about downloading those materials, adapting them to your region or country, and then delivering them in person, should that be something that you wish to fund and engage and get support with. You then go on to our online portal, which we believe is, we've just been working on that, so you may have seen changes. If you haven't visited us for a while, I suggest you come and visit us, because you will see that we now hopefully have a much more easy, accessible and guided step-by-step approach for candidates seeking to submit their applications. And I won't go into the details, but hopefully you can see once you come online how to do that, but we can take you through. You can take the exams, as I say, and these are real pictures of people taking the ICAP credentials. You may recognize yourself from the back, or you may recognize the venue, but also we do involve and have the opportunity to do remote exams, and that's something that we can do as a large group, or we can do it individually within your home. The re-credentialing is equally, as I say, important. We don't just stop. We are into lifelong learning. You need to ensure that you're maintaining your standards by continuing to learn and evolve. So re-credentialing is a critical process that helps ensure addiction treatment of professionals remaining competent, ethical, and capable. It keeps professionals up to date, et cetera, et cetera. I think I've mentioned that. And then for addiction professionals, re-credentialing, it's not just a regulatory requirement. We believe it's an investment in their personal growth, the quality of care they provide, and ultimately the well-being of their clients. So what we asked for your re-credentialing, some people believe, I think there may have been misinformation, they have to retake the exam. That's not the case. All we are asking is documentation of 40 contact hours of education and training during that 3-year period of practice. Of the 40 contact hours, 20 must be on substance use related matters specific to the area that you're seeking to re-credential, such as prevention or treatment or recovery. The other 20 hours must be in other subjects, but should be related, as I'm sure you could appreciate, and they must include some ethics update training, and all training must be provided by a GCC approved training provider. And by that, we are looking at principles about what is and who is considered a provider. If you're unsure, then again, that's something we're very happy to have a conversation with you. You can email us and you can check that out, but we would hope to respond to that very quickly for you. Submission then of the completed application for the renewal of the appropriate level and professional agreement to continue, code of ethics for credentialed professionals, and then of course payment. And just if the charges for treatment is at this moment, it's $100 to take the treatment credential. To re-credential, it is 50% of that, so it's a $50 tag. If you're taking the prevention credential, it's a $50. And so to re-credential, it's 50% of that, which is 25. So we do a 50% to do it, because it's really just trying to cover the administration and a review of your documents. The exam, of course, it costs a little bit more. We are looking at costing, and I'm happy to take questions on that. So finally, just to explain, the ICAP Credential Professional, we've just updated our platform so that it is more responsive. This may be new to many of you, but what we will have within the next at least, I'm hoping early 2025, we will be in the process and coming out to let everybody know automatically when their credential starts to move towards expiration. So we will be prompting people at 6 months, then 3 months, and then 1 month prior to your credential expiring to recertify. You will also then be given a 3-month grace period post the date of expiration, just in case people are still trying to catch up. Should the professional fail to reapply, their credential will be archived and they will no longer be eligible to use the ICAP credential. And to assist and support that, both for the individual, but also employers or government agents, the GCC will have from 2025 a live register of all ICAP credential professionals. So you will be able to go onto our site, you will be able to put in the name of somebody who is purporting to be credentialed, and their name should come up and identify them as live or archived. So we believe that that's going to be significantly important to support the re-credentialing process and ensure that people who are using this credential are using it in good faith. A credential portfolio and continuous professional development toolkit is currently being developed, because we recognize it can be difficult to track what you do and to make note of those 40 hours. So we will be putting those tools together to support you, and that's something that will be coming early 2025. So please keep an eye. So I'm going to stop at this point. I know I've probably overshot slightly, but there was a lot of information to share. I hope that was as clear as we can make it for you at the moment. I'm more than happy to stop sharing, so that I'm going to stop sharing for the moment so that you can see me, and then we can call out to see where we are with all of the chats. And what people have been telling us. Verna, I think Sunju is helping you as well in the background. But thank you for your attention. And I'm delighted that you've managed. I think we've largely kept most people here with us. Indeed, many people joined a little bit late. So hopefully you'll be able to get the slides and catch up for any aspects that you missed. But thank you so much for your attention. Verna, I'll pass back to you.
Thank you so much for such an excellent presentation. So let's begin the question and answer. So there's quite a few questions involving processes. So in terms of like the duration, like how early should they apply for an exam, and also like if they're filing for renewal, normally how long does the process takes?
Okay, so if you don't have your credential and you're interested in obtaining a credential, then really that's going to be a self-assessment in some respect, because we kind of clearly tell you what you need to have achieved before you come forward, and we obviously want to make sure you're successful. That we set a high bar for the credential, so we want to make sure that you're successful when you take the exam, because even though we try and keep the cost low, we understand, it can be prohibitive, and we don't want to have people take an exam and fail. So really what we would suggest is that you take the time to really think through what you're bringing already, so your own preparation. So please do check the details of what are the requirements in order to obtain the credential, not only in terms of the qualifications you may already have achieved by doing some formal training, if you've been already training as a nurse or a doctor or as a social worker or as a psychologist or as a general counselor. You will be bringing that with you, but have you done the specifics around addiction? And if you have not, I really encourage you to look at the self-led directed courses that are on the ICAP, because they start to give you a good sense of the curriculum and the competencies that are required to be a professional in this field. So if you're unsure, please do a self-assessment yourself. Take 1 or 2 or 3 of those short courses, self-directed, see how you do, because you do get a badge, a certificate from completion. And if if you believe you're starting to hit the right numbers in terms of completion and understanding, then I think that starts to tell you that you will be ready to take the exam. So that's just in terms of knowledge. In terms of experience, you do need to be practicing. You do need to be able to give us evidence, particularly from a supervisor and from a bona fide treatment provider. We really do need you to be practicing where we recognize that the entity that you're working for is recognized in your country as a legal entity that is allowed to practice what it's doing. So I'm sure you know what I'm getting at when I say this is not just that you're having a conversation and maybe doing a little bit of informal counseling with people, although that might be helpful. That's not the practice that we're referring to. We recognize practice that is in a bona fide treatment, prevention, or recovery service that is recognized within your country. So do please make sure that that is where you're practicing and getting your experience. And then you will and should be able, even if you're doing it at a voluntary level, be able to get a certificate from your supervisor to confirm that you have gathered the hours of experience required in order to sit for the examination. So those two are really important elements in terms of preparation. In terms of recertification, I would say you must recertify every 3 years. And during that 3 years since your exam, we will be expecting that you have undertaken at least 40 hours of continuous professional development. And there are details around that within our site. So please do check that out. But of course, you continue to practice, and we will be asking for certification from your supervisor that you have been continuing to practice and practicing to a standard without exception. So those are the sort of things we're looking for to ensure that you have the right to remain on the register as a credentialed ICAP professional. So I hope that answers those two. Thank you, Verna.
Thank you, ma'am. And normally, where can they find the schedule for examination?
Oh, that's a great question. So at the moment, we are really moving. So since the GCCC has moved over into ICUDDR, one of our ambitions as a group within the ICUDDR is actually to try and set up an annual schedule. That doesn't exist at the moment, okay? So just to be clear, examinations are usually set up, as I say, there's two ways you can take the examination. One is either in person through a pen and paper exercise, and one is remote. Usually, and at the moment, most of the examinations are actually, and I have to say we're very grateful, either through Columbia Plan or through government agents, are sponsored. And so what tends to happen is people are exposed to training through those sponsored agents. They then complete that training and notify us and ask us then to put on an exam. And so we would either make our way to a testing center in country where the participants and candidates who undertook that training can then come and take that exam as a pen and paper, or they can take it remotely, depending on the funding stream and the training that they've undertaken. Now, that doesn't mean that individuals cannot apply also individually. And we are looking now to see, can we establish through our ICUDDR membership testing centers globally, so that we can actually increase access to the credential via the testing centers and put together a schedule. So I would ask you to be patient with us. We are working towards developing an annual schedule of testing centers where you will be able to access. But in the meantime, if you're wanting to take a credential exam, please contact us individually, because we can set that up remotely for you in your own home. So if you're not part of a large group undertaking the certification or the training, we can do that individually for you.
So, ma'am, so I also have to say that Carmel is doing a great job, and she just joined GCCC. So there are a lot of things on the pipeline. So
Yeah,
that's
absolutely.
something, right, that we have to
Yes.
consider.
If we haven't delivered all of these within the next year, you can certainly come and beat me up a little bit more, but we are in the process of thinking through different ways. So please be patient with us. And indeed, we're really wanting to engage with our audience and the people who are interested in credentialing. So if you have ideas, if you have, sort of fresh eyes as to how you would like to see this moving forward, I would love to have a conversation with you. please don't be shy. Please send me an email with your ideas, with some thoughts, and I will reach out to you and we can set up a Zoom conversation, either individually, as a larger group, or as a country response. I'm currently trying to get around countries at the moment. I've just had, as I say, a wonderful trip to Kenya. I've just had some lovely meetings with some of the representatives in different countries like Ghana. And I know that there is a huge appetite at the moment for us to get this right. So I'm really interested in co-creating this, because I understand many countries have already got credentialing, sort of frameworks, and I'm not wanting to unpack that in any way. If it's working for your country, that's wonderful. But can we talk to see if there's reciprocity that we could explore to expand that? Or if you have nothing, then we'd be very happy to help you put together a toolkit to establish a credentialing system that we feel is fit for purpose. And I hope that what you've heard today reassures you that we think it's there.
Okay. So you also mentioned about the sponsorship or the hosting, about
Yes.
so is it like an open invitation? Like, can people join? Like, if there's an exam in their country, like, who should they what's the process and who should they connect to?
That's another great question. As I say, most of the in-country exams that we have been running tend to have been sponsored, as either by a private trainer who's delivered training, or an agency, or a treatment provider. I have to say, as you would expect in our sector, people are extremely open and warm. So once we know those dates, usually it's through invitation only. But if we have somebody who would like to join and take the exam, then we can actually, on behalf of that individual, ask that person, can we add somebody into the treatment or into the examination? So that has happened. So often we might have candidates who aren't necessarily sponsored by that particular agency who set up the exam, but they're happy for them to sit in because the exam is running. So that's really how, so what I'm saying is the opportunity is there. So don't be shy to ask us. And ultimately what we're trying to do is get a schedule together so that people can see what's happening in their country. And I think what we haven't been good at communicating is when there are exams pending, so that people can see. So we've literally just actually, for our next newsletter coming out in November, we've put a schedule of exams that we know are happening. These are through invitation, but if you see the dates and it's related to your country and you think you would be ready to take an exam, please contact us and we'll see if we can add you into that examination.
Okay. And then in that case, so like, how long should, like, in terms of duration, right? So
Yeah.
how early should they apply, or should they connect to you with regard to?
So you mean if they see an exam advertised, how quickly should they get in touch with us?
Yes.
Right. Okay. So that's a really great question, because of course it's not just as simple as you can imagine. Oh, I'd like to take the exam. Can I come? You do need to, and this is really to protect the candidate as well as anything else. As I say, I don't want any candidate coming forward who is not prepared or doesn't meet the minimum criteria, because if you may be fully qualified and have lots of experience, and indeed maybe even qualified up to the point of a PhD, but if you haven't done the hours in practice, you will not get the credential. So it's not just about, ability to show and demonstrate that you have the knowledge, but you have to show that you have the applied. So we really need to look at both. And that's why when through the application process for the credential, we assess that, and we will come back and explain to you if you have not yet met the minimum criteria. So yes, we do need, and I think actually Sunju is on the call. I think we ask and usually work with about a 6-week run-in time to an exam, or am I being too shy, Sunju? Is it 6 or is it 8 weeks before an exam?
I think it's the range of 6 to 8 weeks.
It is about 6 to 8 weeks. So roughly, to be on the safe side, you need to be applying at least 2 months before the date of an exam that you see scheduled, in order for us to process you. You do get opportunity to submit. We then review. then we ask you to resubmit if there's some aspects of the documentation missing. So we need opportunities, and we give usually about 3 opportunities for people, because we understand it can be difficult pulling information together. So often people miss parts. So we have 3 opportunities where we ask and we give you an opportunity to come back with more information if you're a little shy in some of the documents. So to allow for that, at least 2 months.
So is there like also a limit to the number of times a person can retake the ICAP exam?
No, you can
Oh.
you can continue to take. What we won't do is well, 2 things. You know, if people take it 2 or 3 times, I think I'd like to have a chat because I think, you know, maybe we're doing something wrong, or maybe the training that they have been receiving has not been of the quality. Something is happening. So I think, and I'm sure that that makes sense to most people. However, you know, it's not unusual that many people take the ICAP exam first time, and unfortunately are referred, as we say, who have just not, you know, just been shy of the benchmark pass. So therefore they have to retake. What we do say is that you don't take it straight away. Okay, so we would ask for a period of time before you would take it again. So we would look at that with you, and then we would have that conversation as part of the feedback, so that people are not just sort of back to back, sort of trying to take it and then take it again a week later. That's really not the way it works. So we would give people an opportunity to absorb why they have not passed or got to the benchmark. And then we may even want to give some recommendations that they go back and do a little extra training or a little extra practice and so forth, so that they can prepare for the second. And usually on the second attempt, as I understand it from our statistics, most people get through on the second attempt if they haven't on the first.
So there's a question if you provide training or prepare people to take the examination.
Yes, so that's not our focus. So our focus is credentialing. But what we do is we direct you to where we know there are really good treatment trainer providers. So we have a list of, I mean, the starting position we would argue is with the ICAP platform, because we know that the Knowledge Hub is very, very comprehensive in terms of the training that has been developed and set up by experts globally, and it has been reviewed in a very rigorous manner, the curriculum. So it really stands up to scrutiny, and I would suggest that if you have not yet explored the ICAP network in terms of the Knowledge Hub and the professional development site, that's a really great starting point. But this is where the value, I think, of ICUDDR is. I connect in with yourself, Verna, and with Carly, and people who are into the university network. And there are many, many of our members within the university network offering training and diplomas and certificates and degrees and masters, offering superb training. And many of that, or much of that, is also, I think, available as a distance learning. So we would certainly direct you to where our members are. And we're hoping to continue to build that and enhance on that, as we certainly in GCCC get to know the ICU family a little bit more than perhaps we have done under the Columba plan. So this is really the kind of the future direction and trajectory, is that we really hope that on the GCCC side, we will be able to not necessarily say that that training is the best training. That's not our job. We're not in to evaluate certainly those training centers, but we can certainly give people an indication of where we know there is some really good training available.
So I would
And
like
I should say, sorry, just I added, I think, on the re-credentialing side, what we are hoping to do, and a piece that we're working on and hopefully will be available early 25, is a toolkit on how to track your portfolio for re-credentialing. So we will be giving tips and guides on our website. And I actually had a lovely conversation with some colleagues in Kenya who think that we should be developing a community of practice. And I'm hoping to start a network of credentialing coaches in each country. So I know that one of my colleagues in Kenya has already nominated and volunteered her time. She's a professor in one of the universities. So if there's anybody listening to this who would be interested in becoming a credential coach, I have to say it would be through the goodness of your heart. But we would support you with a toolkit. But then in country, if you have people who would like to get credentialed from your own country, we would hope then that you could actually work with them and give them some further guidance locally about what's good training and what's available, supporting them within the local community networks.
And it's also like part of their advocacy. But I like what you mentioned. So it's a reminder that we are not, well, GCCC and ICDDR are not the only organization. We work with others. We collaborate. And
Correct.
one of the good things that we can say that COVID, like the turnout of COVID, it prepared us for distance learning. So now it's actually
It
easier
did.
to meet the credentialing requirements, right?
Absolutely. And I think, personally, whenever I've been doing training, I've or thinking about getting credentialed, I've always found it very valuable to work with another colleague who has done it. But a colleague who's got the same sort of background or understands where I'm coming from. So, really I'm trying to build up those local networks and points of reference in country. Talking with your own colleague in your own language around what your particular needs are is much, much more valuable, in my view, and certainly been my personal experience, than talking to somebody who lives the other side of the world, has a completely different, perhaps, treatment framework that they're working in, or, judicial system or jurisdiction that they have different rules and regulations than where I'm working. So actually working with somebody more locally who has been through that is in my view, much, much more helpful. So we're hoping to build that community of practice as GCCC continues to expand.
There's also quite a few questions, and I would have to say that Sungju is doing a great job answering and providing information on a lot of it. So
Thank you, Sungju.
But
He's
there's also, I
fantastic.
think, yeah, there's a recurring question with regards to the requirement. Like, are people required for ICAP and not the prevention and the recovery courses? Are they required to complete all the UTC courses?
That's a great question. We recommend that it's a good starting position, but some people, and I've been having these conversations since I took over as director. If you already have been working in the addiction field for 20 years, you already have done a master's in addiction studies, to be quite frank, taking the UTC courses, whilst they could be good refreshers and they're good, resource materials, and I certainly would not say to anybody, that it's always worth looking. But ultimately, if you have already taken some, very, advanced courses in addiction in a university or in another educational establishment, that when you come forward to take the ICAP, we can see that this is a formal entity, recognized, it's legal, these are recognized trainers. We would see those as an approved training provider. We will recognize those credentials that have already been taken and that experience. So it's not absolute, but the large majority, and I suspect the large majority, perhaps even listening to me, may be coming from a position where they haven't had the opportunity, because opportunity to take a diploma, degree, master's is not available to everybody. So a large majority of people may need access to a series of trainings that are of a very high quality. And that's where I think the UTC, the UPCs really have their strength. And that's why we recommend people looking at those. What we do require at this moment, and it is something I'm looking at, is that you must take the HIV 6 hours, HIV AIDS, and you must take the ethics. These are prerequisites, irrespective. Now, that's another thing that we're looking at in GCCC. Because if you've already taken a 6-year degree course in medicine or a 3 or 4 year degree course in psychology or nursing, I can't for one moment imagine that you haven't done ethics, because that usually is required for any regulatory certification in those types of professions. Although we do recognize in ethics that there may be a dimension of ethics that are peculiar to addiction because of the vulnerability in the marginalized group. So I'm not suggesting that we won't be looking for some additional work around ethics, particularly with this population. But whether it's 6 hours, that's something that I think we're starting to look at. What we're really interested in is credentialing everybody to a standard that we feel that we're comfortable with. We do not wish to make too many hoops, and we certainly don't want those hoops to be on fire. to make it so difficult for people, because we know people are very busy, but we do need to make sure we are the gatekeepers. And if you have our ICAP credential, we want to be able to stand very comfortably beside that to say anybody who has got an ICAP credential after their name, we are satisfied that they are credible, competent, and ethical professionals who you should be employing and taking seriously.
Is really, really great points. So, and being someone who's credentialed myself, I would assure you that UTC 1 to 8 actually really helps. So, because, and for some of you, we might be practicing for a long time, but we also like graduated early on. So it's also like some way of trying to get back into the way again. Because like exams is also a different sort of preparation, right?
Absolutely, absolutely.
And it's also available in ICAP website. Maybe not all the courses yet, but as we keep on saying, and as Carmel mentioned, this is a work in progress. We are hearing what you guys are needing. So we are trying to meet the demands based on the available resources.
Wonderful.
There's another question here that do we award grandfathers
Oh,
right?
grandfathering.
Yeah,
Oh, that's a great
grandfathering.
question. That's a great. Now, I might need further clarification because grandfathering can mean different things. And so I suppose what maybe people are asking is that if they've taken the ICAP credential many, many, many years ago and have not re-credentialed, would they have an opportunity to come back? So what I'm going to do is I'm going to dodge it slightly by saying, if you find you're in that position and you're very keen to get yourself back onto the live register, then please write to me directly. Okay. And I will, deal with individuals in relation to the historical position around the credential. That's if you took the ICAP many, many years ago and you've just let it lapse, and now you're thinking, and quite rightly, you would like to be back alive on the register. I'm more than happy to have that conversation with you, but no guarantee at this moment till I can see the individual and what the profile is and where people are. In relation to grandfathering can be attached with reciprocity. So it can be that I have a credential in something else. Can I get ICAP reciprocity because I'm already recognized by NADAC, for instance? And we do have some arrangement with our NADAC colleagues that NADAC maps or transfers over to the ICAP credential. So again, if you are holding a credential from some other organization and you're interested to look to see how it may fit or align with an ICAP credential, I would again ask you to represent yourself to me in an email, and I will then follow that up with you individually. We certainly, as we start to engage in our new role within ICUDDR, these are all of the things that myself and the team and the commission are looking at. We're doing a full audit on all our practices, and we're taking the opportunity with the transition, like anything else, a sort of what we're calling a stop, start, continue approach. So are there things that we should stop that have certainly not been working for people based on feedback? Are there new things we should be doing because the landscape is changing, or indeed people have different needs? And are there things that have been excellent practice that we should continue to do so? So we are looking right across all our practice at the moment. So if there's things that you think we should be hearing and knowing about, please do let us know. We are in the process. We've got one survey that Sunju in actual fact has been taking a lead on, looking at the awareness of the ICAP. And so if you've been receiving an email about how aware you are of the ICAP, please do participate in that survey. But also, again, early in 2025, we hope to come out to all our constituents that are on our database to invite you to comment and feed back to us your experiences. So watch this space, because I'm really keen to engage with our constituents to find out what is working for you, what isn't working for you. And certainly if there are new credentials do you think we should be paying attention to add to our portfolio, we're very happy to have that conversation as well.
Okay, and probably maybe second to the last question, you mentioned
Yep.
about NADAC, and like it's because it's like a partnership counterpart with ICAP. Do we have the same similar organization in terms for the prevention and credential and the recovery coach? Or is
Not that I'm fully aware of. Now, one of the things that we are, and indeed Sunju and the team and I are looking at, is really looking to see who's operating in our space. That we've, we have a relationship with many of these organizations like NADAC, but I'm interested in, reaching out and talking to others. So again, this is something that we will be starting to look at. Forgive me if I keep sort of saying this is something we're looking at, but we really have only just kind of formally made that transition formally since the 1st of October. So we're knee deep in thinking how do we grow and how do we develop. So these are fantastic suggestions. We're making note of all of the feedback we're getting and various conversations that we're having at the moment. So again, I would hope maybe with your support, Verna and Carly, that I will come back again maybe in 3 or 4 months and do another further update through this medium to let people know how things are progressing. And certainly in between, please do reach out and have that conversation with us.
We'll hold you to that. This is recorded, so yes. This is one last interesting question. So if a person already has the certification, if she passed the ICAP, the question is, will she be qualified to open her own clinic?
Oh, that's a great question. That's not our gift. So I think what I would be suggesting, depending on which jurisdiction you're working in, I strongly suspect that there will be rules and regulations about how you start a treatment service and what are the requirements, not only for you as an individual owner, if you're starting up a treatment provision or a recovery or a prevention service. There will be rules and regulations associated with that within your respective jurisdiction and country. So the starting position I suggest to you would be to inquire first about what that would look like, then perhaps look at similar services in your country who are already operating and maybe reaching out to directors or owners and finding out what they have to do. But certainly I would say anybody who is starting a new service and seeking to have a quality indicators, the more credentialed staff you have working for your service, the better that's going to be. And that should include, in my, you would expect me to say this, but I think that would be wonderful if the owner and director of a new service is credentialed, because it gives an indication of where they believe the standard should be.
Very well said. And also, like, we also have to reemphasize what Carmel mentioned. We encourage everyone to take the credentialing as professionals, but you also have to be aware of the laws and regulation in your own country, especially if you're opening a clinic, because that's also a different set of, there are different parameters to that as opposed to just a private practice.
Exactly. I'm just, because I saw just on the side, I out of the side of my eye, people asking for the contact. So the 2 QR codes that are up on your screen at the moment, the one I believe on the left is the ICUDDR and the one on the right is the GCCC. That's my email address, clancyc@icuddr.org, if you wanted to reach out to me personally. So please take a screenshot of that. But as Verna also mentioned, this entire presentation will be available. And so you will be able to cross-reference at some point to go back. But if you wanted to get that quickly and how to reach out to us, please just take a screenshot of that before we close down.
Yes, and also like Sungjo also provided the GCCC_info@icuddr.org. So like you can see all of this in the directory, and because this is like we will be sharing Dr. Clancy's presentation, so you guys will have a copy of their email address. So I guess that ends our your presentation, and a lot of like accolades from our from the audience. So we thank you so much, Carmel, for this lovely presentation, and
Thank you.
I hope, I hope that everyone has actually like you benefited from this. And if you have questions, I know that the credentialing requirement seems to be a little bit scary. Feel free to reach out to them. They'll be happy to answer and guide you with all of your questions. And before we end, we would like to invite everyone to our next event that's going to be on December 11. We're going to talk about higher education in action, ITTCs, driving evidence-based practices, which is basically all of everything that what we're doing is trying to create a standard for great practice to be of service to the people in need, safeguard the profession, and safeguard the people also. Okay. So thanks again, Carmel, and thank you everyone
Not at
for
all.
staying with
Thank
us.
you.
We are happy to have you here, and we hope to see you in our next event. So have a
Thank
good
you.
day, everyone. Thank you.
Thank you, everyone. Thank you very much for continuing, to keep your attention. It's been